Imagine slowly losing the ability to recognize the people you love, forgetting the way home, or even struggling to find the right words to say. This is the reality of dementia, an illness that doesn't just affect memory but every part of life. Today, we're diving deep into what dementia really is, what causes it, how it affects the brain and body, and the treatments that exist. Dementia is not a single disease. Instead, it's a general term that describes a group of conditions affecting the brain. These conditions interfere with memory, thinking, problem-solving, language, and even behavior. The most common type is Alzheimer's disease, but there are others like vascular dementia, Lewy body dementia, and frontotemporal dementia. But what actually causes dementia? In most cases, it comes down to damage to the brain cells. Neurons, the brain's communication centers, get damaged and lose their ability to connect. Depending on which part of the brain is affected, different symptoms appear. In Alzheimer's disease, sticky protein clumps called plaques and tangles build up in the brain, disrupting normal cell communication. In vascular dementia, reduced blood flow from strokes or clogged blood vessels damages brain tissue. In Lewy body dementia, abnormal protein deposits, called Lewy bodies, collect in brain cells. And in frontotemporal dementia, the frontal and temporal lobes of the brain shrink, altering personality, judgment, and behavior. At first, symptoms may seem subtle. A person may forget where they placed their keys or repeat the same question, but over time dementia affects more than just memory. Common symptoms include confusion about time and place, difficulty speaking or understanding language, struggles with problem-solving and planning, mood swings, anxiety or depression, trouble recognizing loved ones, and eventually, changes in physical ability, like balance problems or difficulty swallowing. So, what's really happening inside the brain? As neurons die, brain regions shrink. The hippocampus, responsible for memory, is one of the first areas to be damaged. Later, the disease spreads to areas controlling language, judgment, and motor function. This is why, as dementia progresses, people may lose the ability to perform basic daily tasks, have dramatic changes in personality, and eventually need full-time care. Physically, dementia can cause stiffness, difficulty moving, trouble eating, and even weight loss. In later stages, many patients become bedridden. Unfortunately, many scientists haven't found a cure for dementia yet, but treatments can help manage symptoms and improve quality of life. Medications like cholinesterase inhibitors and memantine can help slow memory decline in Alzheimer's. Therapies, such as occupational therapy, speech therapy, and cognitive exercises, can help people maintain independence for longer. A healthy lifestyle, including regular exercise, a brain-healthy diet, good sleep, and social engagement, can also protect the brain and slow progression. Support from family, caregivers, and medical professionals plays a huge role in helping someone live with dementia. Dementia is one of the most challenging conditions of our time, not just for those who live with it, but for their families and loved ones. While science continues to search for a cure, awareness and understanding are the first steps toward providing better care and compassion. If you or someone you know is showing early signs of dementia, don't ignore it. Speak with a healthcare professional because early detection can make a real difference. Thank you for watching. If you found this video informative, consider subscribing for more in-depth explanations about the human body, health, and science. And remember, knowledge is the first step to awareness.